COVID has a tremendous impact, folks, on the medical industry. We've seen doctors who have been quitting, doctors who have been dying due to COVID-19, nurses, same thing, frustrated with what's going on, many of them in tears with the massive amount of death they have been seeing. In September, the Nurse Grid published a survey of 10,000 nurses to get a sense of really what's going on. 92% say they have experienced a shortage of nurses. 56% say they experienced a lack of beds. 77% of nurses acknowledge high levels of burnout and mental health issues. 4 out of 10 say they were doing their best with a shortage of medical supplies, and 1 in 5 nurses said they were working in facilities where patients were housed in temporary areas of a hospital like tents and field hospitals. Joining us right now is nurse practitioner Wendy Garvin Mayo. Wendy, glad to have you on the show. First, you're there in Hartford, Connecticut, and people got to understand, nurses are the backbone of the industry. You don't have a doctor who is the one who is taking care of patients. Most of the time, it's really the nurses. And so what is this industry doing? Because, look, if you're losing these experienced nurses today, this problem is not going to be a 6-month problem. This is going to be a 5 to 10-year problem if you're not filling in, folks, with the next wave of nurses.
Yes, so it's only going to get worse. The American Nurses Association predicts that 500,000 nurses will be retiring by the end of the year. And that's in addition to nurses who are leaving the profession because of stress in the workload and the work conditions. And nursing schools are not pumping out enough nurses because we don't have enough faculty. So that's also going to contribute to the nursing shortage. So we are definitely in crisis mode when it comes to the nursing shortage. So healthcare facilities really need to take action to support and retain the nurses they have, and also put in structures that will support the new nurses that will be launching into the workforce in December and then again in June of next year.
And so what else can be done? Is it financial incentives? Is it incentives when it comes to encouraging more people to actually major in nursing? What should be happening here?
So we need to first recruit more nurses into higher education because we don't have enough faculty to actually teach nurses. So I think that's one start. The second start is we do need to start recruiting individuals who are interested in nursing to go into the profession. But secondly, we also have to build in support once they're launched into the workforce to keep them there. Because you can have nurses coming into the profession, but if they're going into an area that is full of burned out nurses and staff, that's not very supportive. So that's going to make them leave. So we need, wellness programs to be implemented that's going to really help support nurses' mental and physical health and their overall well-being. So, I think, people need to really look to Washington, D.C., really get involved in policy so we can start mandating that nurses have the resources that they need in order to sustain themselves so they can provide care to patients.
Questions from our panel. First up, Faraji.
Well, I appreciate you, sis, for coming on and talking about this issue. And as I've been talking to our watchers on YouTube and whatnot, a lot of people are saying that nurses aren't getting the pay that they deserve, and that this may potentially change that dynamic. Do you foresee that changing that dynamic, considering that a lot of people have been leaving their jobs and professions that they've been in for a very long time? If there is a mass strike, if there is a shortage of nurses, how do you foresee the industry responding to that? Or should we expect even more money? Should we expect better work conditions? What do you foresee as being the response to that?
Yes, so I don't think it's money, to be honest, because what we do as nurses, you can't really pay us enough. And right now, they are trying to fill the gap with travel nurses who make 3 or 4 times more than a nurse who's hired by a healthcare institution. So it's not money, it's really work conditions. Nurses really just want to feel valued, respected, appreciated, and understood. They're there, they're stressed, they're burned out, but they still show up to work. They still show up to serve, but they meaning healthcare institutions, need to bring nurses to the table and make sure that they're being heard, they're understood. They have the solutions. We just need them to be listened to and have those solutions implemented to really improve the work conditions that nurses are currently working in.
Okay, yes, ma'am. Thank you, sis.
Kelly.
Hi, I'm reading a document regarding this issue, and it's saying that 58% of nurses say they will remain in patient care through the end of 2021. 4 in 10 are planning to leave at the end of 2021. I want, like, outside of the rationale that has already been discussed, how much of this do you think is directly related to the COVID pandemic, aside from the I don't want to say normal pressures, but the expected pressures of the job?
Yeah, so in nursing, we've been dealing with stress, burnout, and the nursing shortage. So these are not new phenomenons. So what happens is, because we've been dealing with these issues, when the pandemic hit last year, we didn't have the capacity or reserve to deal with it. So it just really amplified everything. It amplified the shortage because people are leaving the profession, and it amplified stress and burnout. So now these issues are magnified to a point where we're having nurses exiting the profession, which is not good for healthcare, right? It's not good for our citizens. Who's going to really be there to take care of our citizens, right? And then if we have the shortage but persist, you're going to have nurses who are stressed and burnt out, which can lead to decreased quality care and even death, right? Because it's just not good all around. So you are correct. These are not new problems, but COVID has definitely amplified these issues in the profession of nursing.
Michael.
Hello, Sister Wendy. Thanks for coming on the show today and giving us this information. I wanted to know, could you explain to people, how long does it take to go through the program to become a nurse? How long does it take? And for someone who's in college right now and thinking about becoming a nurse, what subjects should they be focused on in school? What classes should they be taking to make sure they can successfully get through the nursing program to become a nurse?
Yeah, so that's a great question. So there are many levels to becoming a nurse, because you can be an LPN, which is a licensed practical nurse. That takes, I believe, a year. You can be an associate degree nurse, where you get a registered nursing certificate in 2 years, or you can become a registered nurse at a 4-year degree school. So someone that's thinking about going into nursing, the first thing I would definitely suggest is you get a mentor who is a nurse who can really guide you through that. To answer your question about what classes to take, that will be your sciences. So your biology, your chemistry, because nursing is heavy in sciences. So those are the classes that I would definitely suggest that someone takes if they are interested in nursing. But more importantly, align yourself with a nurse or a nursing organization so they can mentor you through that process.
Okay, thank you.
All right, then. Well, look, we certainly appreciate it, the work that nurses do. It is a problem, and hopefully we're going to see leaders take steps to ensure that we're replenishing nurses, because they play a vital role in our health care. Wendy Garvin Mayo, we certainly appreciate it. Thanks a lot.
Thank you.